Welcome to a special edition of Newsnight where we go above and beyond the headlines. I'm Pia Ontiveros. The COVID 19 pandemic is as much an economic crisis as it is a health problem, affecting almost 200 countries in the world. As medical decisions are made to heal the sick and to stop the spread of this deadly disease, much needs to be done to revive ailing economies. And today we're going to speak to one of the key economic managers of the Duterte administration. First, here on CNN Philippines, newly appointed head of the National Economic Development Authority, Karl Chua, who replaces Ernesto Pernia. Thank you for joining us, Secretary Karl Chua. Now, the government has a four-pillar economic strategy totaling almost 1.5 trillion pesos. The program is designed to get us through this global pandemic and nurse the economy back to health. Pillar 1 is specific to the cash aid to the poorest of the poor and to support small businesses. Pillar 2, totaling almost 60 billion pesos, is dedicated to funding the fight against COVID-19. Pillar 3 is specific to fiscal and monetary actions. And the fourth pillar is the economic recovery plan. It is in this last pillar where NEDA plays a central role. It is the most crucial part of the government's strategy that can quickly bring life back into the now stagnant economy or not. Secretary Chua, thank you very much again, like I said, for joining us. Well, let's begin with this. NEDA, as the head of the Anticipatory and Forward Planning TWG of the IATF, or Technical Working Group, submitted that the recovery plan to the IATF, which is now considered Pillar 4, just a while ago I was reading that, no, of the government's overall COVID response, which costs 1.49 trillion pesos, almost 1.5 billion. Can you confirm that, Secretary Chua?
Good evening, Pia, and to everyone who is watching. Thank you for inviting me to your show. Basically, as you mentioned, we are in the middle of a dual crisis. It is a health crisis and it's also an economic crisis. And what we are doing now is trying to find the best balance. We are doing this based on a very good understanding of the trade off on every action that we are doing related to the ECQ. So, in terms of NEDA's role, we are, of course, looking at various recovery trajectories. One would say that we could recover quickly. So, that is like a V shaped model. Some people say it's a W shape wherein we recover, but then if we don't really practice social distancing or improve our health outcomes or the health capacity, it could go down again. So that's W. And some people say that we are going to enter into a long and deep valley until we recover when a vaccine is indeed discovered. So those are the things that we are preparing for. And the best way to prepare really is to shore up our present resources and at the same time understand better what the future lies. So one of the things the economic managers did is to prepare the four pillars wherein we are prioritizing first the people who are affected because they don't get work, and we are proposing a social amelioration package for them. And we, as part of that, actually is a second package for the micro, small, and medium enterprises, especially their employees who have not gone to work and are not paid. At the same time, in Pillar 2, we are attacking the health crisis squarely by increasing health capacity, testing, arming our health workers with PPEs, helping the very sick and critical with ventilators and so on. Now, as we work through the pillar, we also have to also prepare for the recovery. And an initial part of that is basically fielding a number of surveys to understand from both consumers and the businesses what are their sentiments, how much have they lost, so that when we design a recovery package, it will be responsive and really targeted to where we should be giving the best support. So that is in general what we're doing. The amounts that you are seeing is as of today, but things are changing as we understand better the needs of the
Mm-hmm.
people.
Yeah.
Then we will adjust and accommodate.
Right. Well, Sec Carl, sige, isa-isahin natin ito, no? And we will go back to the consumer and business survey, which is part of Pillar 4, that part of the report. But US DOF, USEC, Undersecretary, before you were NEDA, no? You did participate in the drafting of these four pillars reports. And this is why, and this is just an aside, no, this is why you are NEDA chief, no, so that you can reconcile the DOF and the NEDA response strategy, correct?
Well, in the economic team, we are one team and we make collective decision because in any action that we make, it has implications on the budget, on the revenue.
Right.
So I wouldn't. So that is, I think, the first thing we have to make. We are one economic team, and we try to make sure that all our
Mm.
policies are consistent. In fact, we are also consistent with the monetary policy of the central bank.
All right. Let's talk about Pillar 1. Dahil nabanggit mo na rin, ano, this is about 590 billion. Like you said, yung social amelioration, the small business wage subsidy program for the employees. Just very briefly, how is registration coming along for these firms? No? Are there any snags and what are the fixes for this?
Well, okay, just a background. When the president decided to impose the enhanced community quarantine, it of course led to a way for us to buy time and push back the peak so that we can get our health sector ready. And what that also means is that we have to mandate people to stay home so that we do not go out and spread the virus. So the World Bank, I think, or international experts have already told us that this action has actually led to the saving of almost 100,000 lives. But at the same time,
100,000, right.
there's a consequence to all this. Nothing is perfect. There's a trade-off. So the consequence is that the far majority of the people cannot go to work. So the first thing we did was to provide for the poorest and the poorest 18 million low-income families a social amelioration package wherein they will get between 5 to 8,000 peso per month for 2 months, and that is ongoing. Now, the next priority is we need to help the small businesses because although they are in the formal sector, they don't really have enough access to capital or liquidity or a lot of savings to support their workers. So we recently launched the 51 billion small business wage subsidy. And let me tell you honestly that in other countries, they have high-tech systems and institutions, and they can deliver easily. This is the first time that the Philippines is doing such a program, and we had only 2 weeks to prepare. And we think that it should be prepared well, but we have a limited period of time. So what we did was we tried our best, and we know that it's not perfect. So we have Plan A, Plan B, Plan C. Plan A didn't really work out well because our websites could not accommodate millions who are trying to find out if
Mm.
they
Yeah.
qualified. So, but right now, I understand from the SSS, they have actually sent out already hundreds of thousands of emails so that they can inform those who qualify that they can now apply. So, this is part of the prioritization that we are doing. So first, address the
Okay.
concern
All right. So
of
we,
the
yeah.
poorest and then the
Oh.
small businesses.
We understand on this small business wage subsidy program. So meron lang mga konting snags that you are assuring people that you are fixing this. Meron lang konting problema pero maayos din yan. I wanted to ask also, no, so you're supporting the small business wage sa program na yun, ano. But some owners of some businesses also want to know, for example, number one question came in, to help small businesses survive, can their tax payments, VAT and income tax for this year, be waived?
Well, okay. First of all, even before the small business wage subsidy, we already deferred or I gave a grace period for tax payments, for rentals, for payment of loans, for credit card, and so on. So they're actually benefiting from that, and that created, additional liquidity or money for them to pay their workers and to meet their other obligations. We are considering two more things. Before I left the DOF, and this was already announced, although details will follow. We are considering guarantees for loans that micro, small, and medium enterprises might take because of the need for a working capital. And there was also an announcement last week by the DOF that they are also going to allow net operating loss carryover so that the losses of businesses this year can be credited or carried over to the next year to reduce their tax payment. So these are already announced by DOF
Mm-hmm.
and are
Okay.
being
Yes.
fresh out the details. So these are being used to help the
Mm.
small businesses.
All right, part of Pillar 1, an expanded net operating carryover. Kaya lang, the worry of some business owners is that, paano kung, what if they need to close? They cannot reopen. They've lost too much money. What happens then? And then they will have another problem. And itong isang concern nila, uh, how will they pay separation pay, for example, to those workers that they have to let go of? And then when they do lay off workers, uh, how do they keep from getting sued? For example, charges filed against them at DOLE, for example, or NLRC. Ang dami nilang iniisip. As a matter of fact, I've heard of some business owners now who are literally in tears every day because of this situation.
Well, that's a very good question, and we are really concerned about the impact of this ECQ on the small businesses and their employees. So let me share two things. Number one, we fielded a survey of 44,000 micro, small, and medium enterprises, answered our online survey, and from there we were able to understand better what are their concerns. And actually, based on the survey of 44,000 micro, small, and medium enterprises, we found that the far majority of them are not really asking for money. What they are asking for are deferments of payments, which actually is the first
Mm.
thing we did.
Okay.
Deferment of tax payment, deferment of rental payment, of
VAP,
loans payment,
SSS,
credit card.
PhilHealth.
Yes,
Oh,
correct. So actually,
yes.
we based on that
Defer payment
survey,
to
we are
debtors.
following. Correct. Yeah. So based on that survey, we are actually addressing their number one concern. Now, their number two concern is they
Mm-hmm.
say they have working capital for the next 2 months, and after that, they will have a difficult time. So our answer to that is that we prepared the 51 billion wage subsidy for small businesses, and actually one condition there is that the employer cannot lay off the workers, and the employee cannot resign, because the main purpose of a wage subsidy, like any country that does it now, is to keep and retain employment. So that is how we are
Mm-hmm.
helping them. Now, as I mentioned also a while ago, that the DOF announced already the other support programs.
Yeah. However, Karl, what if tumagal pa itong ECQ, no? In whatever shape or form, whether it's modified, geographical, or whatever, no? Halimbawa, beyond April 30, May, June, July. So, necessarily, halimbawa, yung 500 plus billion, 590 billion for Pillar 1, kailangan lumaki yan. You will have to continue that support for the wage subsidy and for the social amelioration, right? That is the direction we're taking, just in case we need to extend ECQ.
Well, right now we are in a period of great uncertainty. This crisis is like one in a century. The last time we had this pandemic was 1920. So, in a way,
Right.
we really have to be prepared. And the good thing about this government is that in the first 3 years, we actually prepared very well. We passed national ID, and that will be used eventually to target the beneficiary so they can open bank accounts, and we'll be giving the support directly to their bank accounts. We passed three packages of the comprehensive tax reform, and that money, that resources, is actually allowing us to keep the economy in a very good shape. That is parang insurance
Mm.
siya that we took before, and now we are calling that insurance policy. Can you imagine if we did not do anything? We just enjoyed the good times and did not pass any tax reform. Where will we get the initial money to support? And because we passed the tax reform, we
Right.
are
Right.
credit rating BBB plus. We can borrow cheaply, and that's what we've actually been doing. And we are being supported by a lot of our development partners in the World Bank and ADB, and that's what we are using. Now, of course, we have to use it judiciously and prudent. So that's why we are doing a survey. When we do the recovery plan, it has to be well targeted. It cannot be just everyone. So this is the
Mm.
process that we
Okay.
have to
So,
go through.
Carl, parang, ang sinasabi niya, we have strong economic fundamentals, and in health terms, kumbaga, we already did the prevention, so yung cure hindi masyadong masama, no? And because you're saying in so many words, malakas naman ang ekonomiya. And but categorically, be categorical about this, Carl, no? So we will be able to sustain this wage subsidy program, to sustain the social amelioration program, no matter how long it takes, no matter how how long the extension, the ECQ goes.
Well, everyone has to work together. We cannot sustain this forever. But we are doing a
Mm-hmm.
lot already on during this ECQ to improve or increase our health capacity. So, for instance, a month ago we hardly test anyone, less than 1,000. Today, I am told we are testing 5,000. By next week, 9,000, and there are
Right.
plans already in
Okay.
place to
All
test
right.
more. So once we take into this all this into consideration, we can quickly test people, isolate those who are sick, and so that we don't have to prolong this ECQ for a long time. In fact, in
Okay. So
all
in
the
other words,
data that
yeah.
we see here has shown very big improvements in terms of health progress, and we will build on that.
Okay, so in other words, yes, what you're saying, Carl, is that what you're hoping for is that people will cooperate, no, and do whatever it takes to stay healthy, to stay safe, and then of course plus the testing, etc. Para hindi na tayo umabot sa ganoon na kailangan humaba pa masyado or like you said, yung W model, no, lurching from lockdown to relaxing back to lockdown. But anyway, Carl, I wanted to ask, since
Yes, yes.
we've spoken quite a bit about Pillar 2, yung healthcare, no? Yung Pillar 3, very briefly lang, so you're allowing banks to have cash available for more loans, no? Meron na bang nag-avail nun? Or ano yung update dito?
Well, Pillar 3 is about both securing fiscal resources and having more accommodating monetary policy to increase liquidity. I was told by a central bank that every 1% reduction in the reserve requirement frees up 110 billion pesos to the economy. But Pia, we are not a command and control economy. Like when we don't know what everyone
Mm-hmm.
does. What we do in the government is to provide the enabling environment to allow the businesses to
Okay.
operate and to provide them the support and
Okay.
liquidity. Well, of course, banks will have
Okay.
to lend them. We'll have to be careful that those who are borrowing are really the good ones so that they can manage the risk. And we are going to help them with the guarantee that I talked about.
All right. Sige, punta na tayo dito, Carl, sa Pillar 4. No? And this is the most, well, riveting because we're talking about what's going to happen moving forward. But kanina, nabanggit nyo na yung survey, no, of these 44,000 MSMEs and what those businesses are hoping for. I wanted to ask first about itong consumer survey. Is this correct? Is this correct? No? More than a third had lower income during the ECQ. And also, survey ng business sector, 65% of the business sector said they had zero sales in March. Is that accurate?
Well, I don't memorize those numbers, but I think it's fairly accurate. And well, 18 million families in the Philippines work in the informal sector, meaning no work,
Mm-hmm.
no pay. Hindi po sila like some people that gets monthly salary and leave benefits. That's why the first thing we did actually was to prepare 205 billion peso so that we can help these informal
Mm-hmm.
sectors now no work, no pay. Now, in terms of businesses,
Okay.
the IATF has categorized businesses according to the essentials so they can operate. The middle one are those that can operate with a skeleton force. And finally, those that are non-essentials and should not operate. So I understand that there are some really with no sales. And maybe they have enough working capital or savings to survive for a month or two, but that won't get them too far. That's why the second priority of the government was to provide that wage subsidy and the support to small businesses. So that
Mm-hmm.
is actually helping them
All
for
right.
the time being.
Mm-hmm. Secretary Carl, kanina you said na nga, no, when I was mentioning figures, you said figures can change any day, and that is very understandable. Dito sa Pillar 4, nakalagay kasi yung estimated losses, and total estimated losses, a little over 750 billion pesos. Is that correct?
Those are from the surveys. I'm not sure what you're reading, Pia, but these are survey results,
Mm.
and we are actually fielding a second bigger survey to understand better the quantitative. Kasi yung first
Okay.
survey that we launched is more qualitative. It's a fast survey to help us understand what is really happening and what are the general directions. And we know from those that most businesses are affected. That's why we launched the support quickly. What we are doing now is we have a bigger survey that focuses on the numbers, and hopefully that will inform us better on the losses. But we do hear from the
Mm-hmm.
private sector, from various industry groups that submitted position papers, and we hear them that they are losing. But we also want them to understand and internalize that this loss has to be put in the context wherein we also balance the health losses that we are going to experience. The more sick people, the number of dead people, if we make the wrong decision. That's why when we make a decision around the ECQ, it has to be based on science and data.
Mm-hmm. A very important word, or the operative word that you use there, Sekar, not balance, no. And that's really the question there. How do we balance things? We need to feed people. We need to keep the supply chain up. We need to keep the factories up so that we can buy food, etc. But we also need to keep them safe. And the other interesting takeaway here in Pillar 4 is yung ways forward. One of them is the national ID system. You have spoken about that. You've said that hopefully in less than 3 months, this is going to be up and running at least for 5 million. But is there any other update on this? We all know na ang daming nag-oppose dito, no? Because of data privacy and many other kung ano. But now it's turning out to be something that can be very crucial, no, for moving forward.
Well, Pia, the general idea or the context today in the Philippines is that 70% of the people don't have bank accounts. And that's because they work in the
Yeah.
informal sector and they don't have an ID. If they try to apply for an ID, the first requirement is they have to produce an ID. So where will they start? So the national ID actually was a 20-year-old proposal that actually got parang approved by Congress a
I think.
25-year-old proposal that was actually approved by Congress
Mm.
2 years ago. So I think there are more and more supporters of national ID. So I've spoken to the national statistician, Dennis Mapa of the Philippine Statistics Authority, and we agreed that we will use the next 2 months to finish all the preparation and the procurement so that when we are allowed to go out in June or July maybe, then we can fast track the registration. If we're
Mm-mm.
allowed to go out in May,
Yeah.
we'll start immediately.
Mhm. Okay, pero 5 million individuals or 5 million households lang? Can you push that number higher?
Yeah, actually, we were given a budget for 5 million. And I am requesting if PSA can register double or 10 million. They say yes, but they need more money. So I'm going to ask DBM if we can give them some money because this is actually a very important project for this year. If we can register 10 million household heads, can you imagine we will have a
Mhm.
much easier time next year to provide subsidies and more targeted support to the poor. So that's in the works now. But the minimum is 5
Yeah. Okay.
million. But we'll try to do more.
All right. All right. Many other items dito sa ways forward. Of course, the community quarantine, yung mga flexi work arrangements na tinatawag, social distancing, e-commerce, travel restrictions, no mass gatherings pa rin. The question on everybody's mind is, will we see and plans look good on paper always, and we hope they can be that way. Will we see a systemic, gradual, and rational restoration of economic activity as the ECQ winds down? And are we going to get out of this alive, no matter how scathed we will be? Because someone, for example, in big business said, we should write off 2020. Pero what's going to happen moving forward?
Well, this is a global problem, and we are trying to learn and understand from all countries how they cope. And one thing that sets us apart from other countries is that first, we have strong macroeconomic fundamentals. That is very clear in the progress of our economic growth, employment increasing, and poverty reducing. Number two, our labor force and demographic is actually young. I think the median age is 24. So we don't have the same problem that other countries have because of their aging population and they're more risky and so on. So I think we have two very good start. What we need to do right now is use this ECQ time to quickly build up our health system capacity so that we are ready in the coming weeks to face any eventuality. Now, so once we have done the preparation, then it will be easier actually to see what trajectory or recovery path we are going to face. Because right now it's extremely
Mm-hmm.
uncertain. So anything can happen. It can be this path or that path or the other path. But so that we don't know. But what we know here is that we are improving our health system capacity, and we should actually do better. And that's what this ECQ is
Mm-hmm.
providing us. It buys us time to improve and be ready.
All right. Secretary Karl, my last question, twin questions. Number one, what is your NEDA's recommendation? Lift ECQ on April 30, modify it, extend it as is? What exactly is it going to be? And are you already thinking beyond that and thinking in terms of economic opportunities for the country post pandemic, post ECQ? For example, Japanese firms moving out of China, how could we benefit, for example? Sorry, so many questions in one question. Go ahead.
Yeah, maybe I'll answer the first and you can repeat the second, okay? Because the signal wasn't that great.
Yeah.
My NEDA's
Okay.
recommendation is to use data and science to determine what the president will decide on. So, unfortunately, we are still waiting for the modelers and the data to advise us. So, I cannot make a recommendation now to the president. But if ever we do, we are going to make sure it is solely based on the science and the data that we get. And it will be a very clear recommendation based on the trade off between the economic gains of people going out, getting an income, and getting money to buy food versus the health cost of possibly deteriorating our, increasing the number of infection and death. So that we will do that and present that to the president.
All right. So your recommendation would be science and evidence based economic opportunities. For example, Japanese firms moving out of China. How can the Philippines benefit? Very briefly, Sec Carl, and then we'll end this interview.
Right. So I understand the Department of Trade and Industry through the BOI is actively, scouting those companies that might be relocating for various reasons, and we will try to target them because we know that we have specific advantages over other countries. So I think Secretary Mondopez might be able to provide more information on this.
All right. Well, Secretary Karl Chua, thank you very much. Maraming salamat. Thank you for joining us
Thank
this
you very
evening.
much.
Uh,
Thank you very much, Pia.
we'll see you again, Sec Carl. And thank you for watching this special edition of News Night, where we go above and beyond the headlines. I'm Pia Ontiveros.